quicker that you start therapy, the higher the chances of recovering some movement and actually gaining a better prognosis, which is a better outcome in terms of rehabilitation.
Right.
So you might not necessarily move the person out of bed in the first 24 hours, but you would start with some exercises and making sure that their muscles involved in breathing are functioning well and there isn't a chance of any chest complications or infections. And thereafter, the rehabilitation can continue in hospital up to about 3 to 6 months in a rehab center, and it can be ongoing.
So what type of rehabilitation you would do as a physiotherapist on someone who's had a stroke?
Physiotherapy deals mostly with incorporating movement patterns. So because of the loss of movement and the changes in what we call muscle tone, and muscle tone is the ability of a muscle to tighten or to relax in order to perform movements. And we find when patients have strokes, they either present with a low tone or floppy muscles, which make it difficult to move in terms of grip and strength. And then we have high tone or spasticity, where the muscles are tightened and movement becomes difficult because joints are rigid. So physiotherapists help to make sure that chests are clear, muscle tone is normalized, range of motion of joints is kept functional basically. We try to improve the range of motion, and we do lots of exercise therapy to try and get the person rehabilitated to the point where they're able to roll in bed or sit up independently. We also teach caregivers and family how to position, and also enable them to move patients while in bed in order to sit upright. And then thereafter that, once we've reached the stage of sitting, we do balance re-education and training. So if they're able to maintain a sitting position by themselves, we then go forward to sitting to standing position and then teach walking.
Right. So